is where it should be. In the meatus. We don't pee from the vagina, we pee from the meatus. Make sure it's not kinked. Who had urinary? And what else, Jessica? What happens if this is kinked up?
It's one
Oh, it's
come
not
out.
the flow.
It's gonna backflow. Exactly. It's gonna backflow. So you make sure this is not kinked.
No.
No.
So when you're cleaning, Arleah, look in that room right there and give me another towel. Now, when you're doing catheter care, bedpan, I think it's catheter care and bedpan. There's already going to be a pad underneath this patient. You have to assume that that pad is wet. So you're gonna have this pad. It's just like the bedpan. You're gonna place this pad underneath on top of day pad, right? Now in real life, you wouldn't remove this pad underneath your pad unless it was already wet. But for testing purposes, here, give me one of these towels.
So with that pad, so if they got a dirty pad
For the test, you're gonna assume that that pad is dirty.
Okay.
All right? So you're gonna put this one. They already got a pad underneath.
Yeah.
So you're gonna ask them, because they want you to talk to every student. Ask them to lift her hips. Lift her hips for me.
Them crazy hips.
All right. Place your pad underneath. All right. So when you're doing catheter care, it must be perineal care. What is this? Perineal care. What is perineal care?
That's fine.
Look down at your peen.
That boy.
Look down at your
The
peen.
janitor, man. The janitor.
So what is pericare?
Vaginal care.
What is it? It's vagina only. So you gotta do pericare. Now, if you watch Vanessa Lee, you're not gonna see her do pericare. I think that's why a lot of people failing this, because they watching that video and not knowing that she don't do the pericare. When you do catheter care, you have to do pericare. Why would you do catheter care and not clean the vagina? All right. So now, first thing we want to do with water is what?
Make sure it's not hot.
Thank you, Mr. Corey. Now, if you use that bedside table, you got to do what?
Clean
Place a barrier. Why do you place a barrier on here?
For spills.
Because this is where he eats. And you're going to put bath water. And what does bath water consist of? Bacteria. That's right. So now you put your supplies down. I need one more towel, Alicia. Go get your water and then have her check it. Do I need to check it?
No.
Why?
It's about up.
Thank you. Okay. Have her check the water for me, Miss Mabel. Is it okay?
Ooh.
All right. I ain't studying about you. I'm trying to get this done. Now, when you're doing catheter care, you got 5 areas to clean. 1, 2, 3, 4, and 5. Should stay right. So once you let her check the water, you soak your towels. Now your rinse towel you can leave in the water. Open your towel up, because putting soap is what? what did I say? Soap is caustic to their skin, right?
Mhm.
So we never put soap on their skin. You open your towel up, put your soap on, and squeeze it. Tell you what, soap comes through,
Yeah.
and then you start your cleaning. All right. This is now your dirty hand, because this is the hand that you're gonna use to clean her with. What did they do to you, Miss May? All right. So the first thing you want to do, this is one, is you're gonna push that catheter over and go straight down. One. Change your surface. Push the catheter over. Now spread the meatus. Two, because when you spread that meatus, you're getting the labia majora and the labia minora. Now with real females, it just lay open. So you push it over, spread the meatus. That's two. Change the surface. Push it over, spread the meatus. Three. Change your surface. Four. Now you're gonna have to change all of your surface, because this is all four. Don't turn it and then do, no. Change the complete towel surface area. Without flapping, and get 5. Okay? Now let's do the pericare again. You're gonna wipe from the pubic down. Hold the catheter. Why are we holding that catheter?
So we don't pull.
So we don't pull. So you hold the catheter and go straight down. One. Change your surface. Push your catheter over. Spread your meatus. Two. Again, opposite side. Push your catheter over. Spread your meatus. 3. Change your surface. 4. Change all of your surfaces. And get 5. Then sit your soapy towel down. You notice I didn't wring this out, because the way I want my patients to be nice and clean. So I'm not gonna wring this out. I'm gonna get it. And as this thing is bothering me. Now I'm going to rinse the same way I clean. Straight down, but now what am I doing? Squeezing that towel. Why am I squeezing the towel?
Get some water.
Making sure that water rinse that soap down. Now I'm gonna hold my catheter, open my meatus. 2. What am I doing now? Push my catheter over, open my meatus. 3. Change my surface, get 4. Change all of my surfaces without flapping, and get 5. Now, I'm going to pat dry. Holding my what?
Yes.
No, I'm holding the catheter now, because I don't want to do what? Pat dry. If I want to change my surface, hold that catheter and pat dry. Change the surface again, pat dry, and pat dry. Okay? Now we're done with pericare. Now we're gonna do catheter care. In real life, with catheter care, we never use a towel. We use alcohol. But for prometrics, we're gonna use a towel. But you seen when I was cleaning, as I was cleaning, where was all that dirt and bacteria dropping down to?
To the catheter.
So does it make sense to use a towel?
Mm-hmm.
That's why we don't use them in hospitals. When we do pericare, then we go to the alcohol and clean the catheter. But for prometric sakes, we're gonna use the soap again. Throw that back in there. When do you change the water?
After surgery, in between.
When do you change it? If it's soapy or the patient says it's cold. Now, how are they gonna tell you that it's cold? It's gonna be the temperature of the towel. Okay? So you change your water if it's what?
Soapy.
Or?
Cold.
So you don't wanna squeeze your soap into this. That's why I tell you to do it over your barrier. Okay? Now, same concept, only you're gonna hold your catheter 2 inches from the meatus, come down 2 to 4 inches, change the surface, hold it 2 inches, come down 2 to 4 inches again. Ring that a little bit. Now, do the same thing. Come down, we're rinsing. Change the surface. How far are we coming down?
2 to 4 inches.
And how far are we holding from the meatus?
2 inches.
Now, the reason why we're holding it 2 inches from the meatus is because in real life we use alcohol. So by this being a membrane, what happens if alcohol gets down there? So we're gonna hold it. Once you are done, do you pat dry?
Yeah.
No. You only pat dry pericare, but the catheter you let air dry. Because if you pat dry, what are you doing? You recontaminate it. Okay? You just got all of the germs and stuff off of it. Now she's all done. You all done, Miss Mabel? Now in the test, when you pull this, your barrier from under her, pull the whole thing. All right? All right, so lift up for me, Miss Mabel. Lift Miss Mabel for me. So when she lifts, you're gonna pull this whole thing from under her, okay?
Which is the pad, right?
Which is the pad. All right? Now, why am I only using this hand? Is there a basket? Let me see that basket right
That's
there.
your dirty
Oh,
hand.
that's true.
Dirty hand.
It does. No.
Okay. That's right. This is what? The dirty hand. Now, everything I do from now on is going to be done with this hand. So now, I'm going to give her back her privacy. We'll bring her railing up. Give her call light. And let her know, all right, Miss Maple, I'm going to go in the restroom and dispose of this, and then when we come back, I'll see what else you need done, okay? So you go dispose of all of this. Do you wash this?
Yeah.
Yes.
Why?
Contaminated. It's contaminated.
Do you dry it?
Yes.
Why?
Because it'll leave bacteria from the water.
Thank y'all. Y'all give me some props back there, okay? Then put all your stuff back together, knowing that all of this is going well
In the
Your
dirt.
laundry?
into the dirty clothes container. Now, when you use this, you come back and clean it. Why do you clean it?
Here.
Because that's where they eat. Exactly. Now, once you are done, you can't do nothing with this hand until you dispose of all of this, and then go and do what? Take your gloves off and wash your hands. Okay? Now you're all done. I'm gonna set this back up for the bath.